Hi everyone, this is Julia Andrews and welcome to my doctoral capstone experience proposal presentation titled Health Promotion and Participation in Low Vision, an Occupational Therapy Wellness Initiative. Low vision is defined by the National Eye Institute as a vision problem that makes it hard to do everyday activities and can't be fixed with glasses, contact lenses, or other standard treatments like medicine or surgery. Individuals with low vision often seek occupational therapy to help them find new ways to engage in meaningful occupations. Current OT practice for low vision focuses mainly on activities of daily living, or ADLs, instrumental activities of daily living, IADLs, reading, eccentric viewing, and visual skills training, leisure, social participation, problem solving, and assistive technology. Despite the efficacy of current practice at improving the occupational engagement of individuals with low vision, many still have difficulties with mental health, physical activity levels, IADLs like community mobility, and health literacy. Though interventions that target these difficulties exist, evidence is limited. Therefore, for my capstone, I want to establish the need for OT to emphasize health and wellness in low vision therapy by developing a health and wellness program at Second Sense. Second Sense is a nonprofit organization that works to increase the independence of hundreds of individuals who have low vision due to a variety of conditions in the Chicago area. It focuses on independent living skills, technology use, and orientation and mobility training. Second Sense also provides its clients an opportunity to attend low vision support groups led by fellow individuals with low vision and offers resources regarding causes of vision loss, tools to aid individuals with vision loss, independent mobility, and communication. Though the services offered by this organization appear to fall under the scope of practice for OT, they do not have an occupational therapist on staff. Effects of low vision on health and wellness. Mental health. Research suggests that adults with low vision experience mental health difficulties at higher rates than individuals without eye disease. For instance, individuals living with eye disease have been found to have higher rates of depression than their sighted counterparts. The severity of depression has also been found to be positively correlated with the level of vision loss in individuals with glaucoma and individuals with age related macular degeneration. Research also suggests that symptoms of depression are most prevalent in patients with dry eye disease, followed by glaucoma, age related macular degeneration, and cataracts, respectively. Moreover, individuals with low vision who exhibit symptoms of depression have also been found to have lower quality of life ratings than individuals who don't exhibit symptoms of depression, regardless of vision loss status. Research regarding effective OT interventions for improving the mental health of individuals with low vision is limited. However, emerging evidence suggests that the use of behavioral activation is effective for preventing symptoms of depression among individuals with low vision. Physical activity. Research suggests that, on average, individuals living with low vision have lower levels of physical activity than individuals of similar demographics without eye disease. Furthermore, studies show that the amount of physical activity and walking performed per day and the level of vision loss are negatively correlated for individuals with glaucoma and age related macular degeneration. Research regarding effective OT interventions for improving the physical activity and health for individuals with low vision is limited. However, emerging evidence suggests that the use of adaptive tango dance for low vision is effective in improving physical abilities. Community mobility. Research suggests that individuals with low vision often have difficulty engaging in instrumental activities of daily living, such as community mobility and grocery shopping. Glaucoma has been associated with fewer daily excursions from the home and a lowered likelihood of leaving the home on any given day. The extent of visual field loss has been found to be negatively correlated with the amount of travel from home, indicating an association between vision loss severity due to glaucoma and increased difficulty with community mobility. Similarly, age-related macular degeneration has been associated with a decreased likelihood of leaving home on any given day, indicating difficulty with community mobility in this population as well. Research regarding effective OT interventions for improving performance of IADLs like community mobility with the low vision population is limited and conflicting. For instance, typical low vision rehabilitation services that focus on helping clients utilize remaining vision, assistive devices, and environmental modifications to promote engagement in ADLs and IADLs, like community mobility and shopping, demonstrate promising yet varying results. Furthermore, traditional evidence-based OT interventions meant to improve and maintain the driving and community mobility abilities of older individuals with low vision have conflicting evidence. Though these interventions are commonly used across practice and may work anecdotally for some individuals, there is insufficient evidence of any significant improvement or maintenance of driving and community mobility abilities for the wider population. Luckily, emerging evidence suggests that mental health practices may help enhance traditional low vision rehabilitation techniques and promote independence in IADLs. For instance, when compared to traditional low vision rehabilitation techniques, interventions involving a combination of behavioral activation and low vision rehab resulted in a greater increase of functional IADL abilities for individuals with age related macular degeneration than just the typical OT interventions. And finally, health literacy. Research suggests that individuals with low vision often have lower health literacy levels than individuals without vision loss, even when adaptive measures like reading aloud to the patient and the use of magnifiers, task lighting, and other assistive technologies are taken. Though the exact causes of low health literacy among individuals with low vision is not fully understood, research suggests ways in which healthcare professionals, including OTs, can promote the health literacy of this population. Methods include describing medical information with precise and plain language, avoiding gestures, checking whether clients can read information, providing written information with clear fonts and high contrast, providing information in rooms with good quality lighting, and providing information in an audio format. My capstone experience will be grounded in the Person Environment Occupation Participation, or PEOP model, which considers how an individual's personal characteristics, chosen occupations, and environment interact to influence occupational participation. I hope to use PEOP as I develop a health and wellness program at Second Sense. I plan to challenge group participants to think about how vision loss impacts them differently depending on the environment and task at hand. My capstone experience will also be grounded by the rehabilitative frame of reference. Interventions grounded in this frame promote engagement in meaningful occupations by helping clients increase their use of remaining abilities, adapt to their environment, and use compensatory strategies. I hope to use this frame as I develop weekly sessions for my health and wellness group. Group interventions will be centered on using remaining vision, assistive devices, and environmental adaptation, and other compensatory strategies to promote health and well-being. Additionally, I will use the health literacy skills framework to guide my interventions meant to increase the health literacy of group participants. The health literacy skills framework looks at how health literacy and health outcomes are related and how health literacy is influenced by factors on the individual level. Finally, I will utilize the Interprofessional Education Collaborative, or IPEC framework, to guide my interactions with other professionals at Second Sense. The IPEC framework maintains that educating individuals in the medical field in an interprofessional setting leads to increased teamwork among the medical team and better patient outcomes. The framework also outlines 4 core competencies to guide patient-centered care. I plan to follow these core competencies as I work in an interprofessional team at Second Sense to ensure that clients receive the best possible care. Individuals with vision loss often experience depression and other mental health difficulties, low engagement in physical activity, difficulty with community mobility and other IADLs, and low health literacy. Though OT interventions that target these factors exist, there is little evidence to support them. For my capstone experience, I hope to establish the need for OT to emphasize health and wellness. I plan to do so through the development of a health and wellness program at Second Sense, a nonprofit organization for individuals with low vision in Chicago. Though through workshops, peer group discussion, and guest speakers, my proposed health and wellness program aims to support client health literacy and independence in occupations such as shopping for healthy foods, exercising at a gym, and maintaining mental health. I will align my capstone experience with the AOTA Vision 2025, which outlines the organization's goals for the profession. I will ensure that my experience is effective by making evidence-based and client-centered interventions. It will also be cost-effective as I help find grants to fund the program for future clients. Additionally, my experience will reflect the leadership qualities of the profession as I hope to raise awareness of Second Sense's programs to medical offices in the Chicago area. I also hope to make my health and wellness group collaborative by including speakers of different professional backgrounds. Finally, my capstone will be accessible and inclusive for people of different backgrounds as I tailor my services to each individual's needs and keep in mind each individual's context during group. The ACOTE capstone areas of focus that my experience will fall under are clinical practice and management leadership. Throughout the capstone experience, I hope to increase my clinical competency in the field of low vision, develop a program, and evaluate Second Sense's marketing and community outreach programs. My first learning objective involves developing my clinical practice skills. I aim to demonstrate clinical competency in low vision OT. To meet this objective, I plan to achieve an AOTA digital badge in low vision, collaborate with professionals at Second Sense in client treatment, and document or write about my experience. My second learning objective involves program development. I aim to develop, implement, and evaluate a health and wellness program at Second Sense. Finally, my third objective involves program evaluation. I aim to evaluate Second Sense's current outreach marketing and sustainability processes. With this objective, I hope to help Second Sense develop plans that help increase the number of individuals referred from local medicine offices to the nonprofit. I've broken up my 14-week experience timeline into 4 phases. During the first 2 phases of my capstone experience, I hope to build rapport with and shadow all of the different professionals at Second Sense. I also hope to work on and achieve an AOTA digital badge in low vision. Achieving this badge will entail taking an online course and test regarding current OT practices in the low vision setting. I also plan to develop a weekly health and wellness group with the faculty at Second Sense for clients who have difficulty maintaining physical and mental health or engaging in a healthy lifestyle, like healthy eating and cooking, grocery shopping, for healthy foods, going to the gym, and more. During the third phase, I plan to run the health and wellness group, search for grants to fund the program, and assess Second Sense's current marketing and outreach strategies to local medical offices. Finally, during the last phase, I hope to gather and summarize data on the success of my health and wellness group from participants, reach out to the local medical offices regarding referrals to Second Sense, and disseminate my project to Rush and Second Sense faculty. Throughout my capstone experience, I hope to search for grants that Second Sense can apply for to help fund the health and wellness program that I will create and their existing programs. I also hope to help the organization improve their marketing and outreach strategies to medical offices and the community. If the improved marketing and outreach strategies are successful, the organization should eventually see an increase in both referrals from doctors and self-referrals. Finally, through interprofessional collaboration and program analysis and development, I hope to demonstrate the distinct value of OT and advocate for the role of occupational therapists in the low vision setting. In conclusion, since individuals with vision loss often experience comorbid health difficulties, my capstone experience will center around promoting the mental health, physical activity levels, community mobility, and health literacy skills of clients of the community low vision clinic Second Sense. Through evidence-based clinical practice, program development, and program evaluation, I hope to positively influence Second Sense's clients' health and well-being, as well as demonstrate OT's unique role in health and wellness in this population. I will ensure the sustainability of my efforts by finding grants to fund my program and other Second Sense programs. In their definition of low vision, the National Eye Association suggests that individuals with low vision have difficulty performing everyday activities. Through my capstone efforts, I aim to alleviate some of these difficulties in the realm of health and wellness. Thanks for listening. And here are my references.